There's this moment every parent faces. Maybe it's the middle of the night, maybe it's after a long day. You're rocking your baby, staring into those little eyes, and suddenly something just doesn't feel right. They're crying, but not the usual hungry or tired cry. It's sharper. Maybe it's nonstop. Or maybe they're just staring blankly, not responding, not acting like themselves. And let's be honest, babies don't come with instruction manuals. They can't tell you when they're sick or in pain. So you start decoding every sound, every wiggle, every tiny change in their mood, wondering, is this just a bad day? Or is this something serious? So how do you know? I want to break it down into 5 powerful signs that go beyond the everyday fussiness. First, listen for a different cry. You know your baby's normal cries, the "I'm hungry," the "I need sleep," the "life is just too much right now." But if you hear a sudden high-pitched scream or a cry that just won't stop, that's your baby's way of telling you something's up. Trust your ears. Second, pay attention to feeding. If your baby suddenly refuses to eat or is eating way less over a few feeds, especially if they seem uncomfortable, it's a red flag. Sometimes it's something simple, but it could also be a sign of illness or even an ear infection. Third, let's talk about temperature. If your baby under 3 months has a fever over 100.4 degrees Fahrenheit or 38 degrees Celsius, call your doctor right away. But also feel their hands and feet. Cold hands and feet with a warm body can be an early clue that something's off. Fourth, notice their tone. If your baby feels floppy, is super hard to wake up, or suddenly stiff, that's not just tiredness. It could mean they're fighting an infection or something more serious. And finally, the most important sign of all, your gut. If you feel something's wrong, even if you can't quite put your finger on it, trust yourself. Doctors and nurses will tell you, a parent's intuition is powerful. Sometimes it's just teething or a growth spurt or a rough patch, but if it's more, your awareness, your concern can make all the difference. You don't have to be a doctor to protect your baby. You just have to be their parent, and you already are. So trust yourself. If in doubt, ask for help. You and your baby are learning this together, and you're doing better than you think.